So, how does being overweight or obese affect your health? What will be the health effects of being overweight and obese? Epidemiological studies have identified overweight and obese as a risk factor, major risk factor for developing ever-growing number of chronic diseases. In this video, I'm going to share with you the findings of one of the largest studies in history on health effects of being overweight and obese. So let's do it right now. I'm Dr. Mura, a certified lifestyle medicine physician, also founder of Dr. Mura Health. Dr. Mura Health is a company that specializes in helping giving you some health information, evidence-proven health information, and some practical tools on how you can prevent, treat, and even reverse lifestyle-related chronic diseases with evidence-based lifestyle medicine. The 2015 Global Burden of Disease study that was published in 2017 in the New England Journal of Medicine. It was the largest study in history that have shown the health effect of being overweight and obese. This study, funded by Bill and Melinda Gates Foundation, analyzed the data from more than 68.5 million people in 195 countries over a period of 25 years. Now, that is a long study. So the study found that being overweight and obese was accounted for premature death and for about 4 million people death every year in 2015, I understand, in 2015. Now, the researchers found convincing or probable evidence of an association with up to 20 health outcomes. Of course, we don't have time to go through all the list of 20 diseases, of which, by the way, you can just find if you read that study. But the major concern of causes of death from being overweight and obese were cardiovascular diseases, diabetes mellitus, chronic kidney diseases, many cancers, and musculoskeletal disorders. You know, sometimes when you think about this 4 million people dying, that could be 4 million people dying every year. And often you may think, no, these people have to be extremely obese. No. By the way, if you just join now, and this is there is our first video, we talked about how you can quantify your weight and know whether your weight status. So please, if you missed that, you can click the link somewhere on the screen and go and watch that. And also, please don't forget to like and subscribe to our channel, and also please leave comment if you want to ask questions. Well, we are more than happy to answer your questions. So out of the 4 million people died in 2015 from overweight and obese, 40%, 39% to be exact, 39% of these people had a BMI less than 30. Their body mass index was less than 30, and so that simply means just simply being overweight can just still lead to this condition. Here in South Africa, for example, we know not only the overweight and obesity is a major problem globally, but coming home in South Africa. For example, in 2016 stat showing that out of 526,000 who died in 2016, more than half, almost more than half, are from non-communicable diseases. 265,000 who died in 2016 here in South Africa were from non-communicable diseases. What are the non-communicable diseases? Of course, you know what are non-communicable diseases. The diseases that that are not infectious by definition, and often they come because of the lifestyle that we practice. That's why cardiovascular diseases, diabetes mellitus, chronic lung disease such as asthma and chronic obstructive diseases, and cancers. All these things they are more related to how our lifestyle, from what we eat and so on. So anyway, in South Africa, 10 out of all the top 10 leading cause of death, 6 out of 10 leading cause of death are non-communicable diseases. Those are diseases that we can do something about. And more importantly, type 2 diabetes. is the number one cause of death in South Africa in women. And that is very, very important. These diseases, they cause a premature death. They affect our economy. They affect everything else in our lives. Now, it's not the subject of our talk today to talk about how does overweight cause type 2 diabetes. How does that extra body fat cause cardiovascular disease and so on. But briefly, cardiovascular disease. Heart disease. When you talk about heart disease, the major concern in heart disease is basically the fatty deposits in your arteries, what you call atherosclerotic plaques. The fatty deposits end up just narrowing your arteries, and it develops over a long period of time. It doesn't happen now. It started developing slowly. Your artery lumen is just occluded slowly, and then what end up happening, the oxygen nutrients are going, that should be supplying a part of your heart, and it's being affected, and at some point there is just acute injury in your arteries that start causing bleed and then occlude that small lumen that remain, and then you have heart attack. Again, type 2 diabetes. Now we know that type 2 diabetes is number one risk factor for being overweight and obese is the number one risk factor for type 2 diabetes. We know that about more than 90% of people who develop type 2 diabetes, for example, are overweight. Now you may be wondering, how does that happen? Well, as an adult, you don't necessarily grow more number of fat cells. The number of fat cells in adult, they don't increase. What happens? Those fat cells they become bigger. They swell up. That's what happens, by the way, when you lose weight. You're not necessarily losing your fat cells. Actually, you are reducing the fat content in those cells, and then they become small. So what have been found is that there is what we call a spilling over effect, whereby basically the more your fat cells swell with the fat, the more there is basically some spilling of fat into the bloodstream. So, by the way, that we as doctors, we can measure that. Basically, you can take your blood and check how much fat cells are floating in your bloodstream, which should be about between 100 and 500 micromole per liter. But anyway, so is that fat cells continue to just go around your body, they end up affecting insulin signaling and rendering insulin to be ineffective. That's where we start getting insulin resistance, which is hallmark of type 2 diabetes. And we'll be covering this in details. But briefly, I wanted just to be aware of health conditions that come with overweight, which is often not considered as major things, but it can be detrimental to your health. So let us know in the comment below, what is your body mass index? Did you check that? What is your what is your weight to height ratio? And what is your abdominal circumference? Let's know in the comment. And were you surprised when you found that? And if there's any other question, please put it in the comment below. And again, don't forget to subscribe and also like our video. Next, we're going to be talking about the evidence-based solution for this overweight and obesity. We're going to talk about another important study that showed how what one can do to be able to successfully lose weight and also be able to treat and reverse this other ill health that comes with the overweight and obese. So see you next. Thank you.